supply of the heart. Ascending aorta gives two branches, one from the anterior aortic sinus known as the right coronary artery, which is the smaller of the two, one left coronary artery, which is the larger of the two, from the posterior aortic sinus. The right coronary artery descends down in the right atrioventricular groove downwards on the anterior surface of the heart. While reaching the inferior border, it loops up on the back side of the heart in the posterior right atrioventricular groove, and on reaching the posterior interventricular septum on the posterior aspect, it terminates and it descends down in the form of the posterior interventricular artery. The right coronary artery has minimum of 7 branches. The first one is this right atrial branch. Then it gives a branch to the SA node, SA nodal branch. Then while coming down on the anterior surface, it supplies the anterior surface of the right ventricle, these multiple pink arteries. Then reaching the inferior border, it gives the right marginal artery. And then when it loops up, it gives another branch to the right atrium, and then a branch on the posterior surface to the AV node, and the last terminal branch, which is labeled as the posterior interventricular artery. The right coronary artery, it will be supplying the right atrium, the right ventricle, SA node, AV nodes, inferior border of the right heart, of the heart in fact, and also the posterior part of the interventricular septum. So the left coronary artery is the larger of the two, arising from the posterior aortic sinus. It runs to the left side in the left atrioventricular groove, divides into two. The larger branch, left anterior descending, or also known as the anterior interventricular artery, it comes down, supplies the major part of the interventricular septum from the anterior side, also gives a bit supply to the left ventricle as well as the right ventricle, reaches the inferior border of the heart, loops back up into the posterior interventricular groove, and anastomosis with the posterior interventricular artery of the right coronary. While the other branch of the left coronary is the left circumflex, which goes towards the left side, and as it moves towards the left side, it goes in the left atrioventricular groove. It gives branches to the left atrium, anterior surface of the left ventricle, as well as the left marginal artery, which will supply the left border of the heart. And here comes the question, what is right dominance, what is left dominance? And I always listen a wrong answer. If right coronary artery is the big artery, it's right dominance. If left is the big artery, it's the left dominance. This is the wrong concept. Always left coronary artery is larger. If, just remember here, if this posterior interventricular artery is a branch of the right coronary artery, it will be known as right dominance. While if LAD, left anterior descending artery, goes back in the posterior interventricular septum and ascends up in the posterior interventricular septum, and this posterior interventricular artery is a continuation of LAD, then it will be known as left dominance. So are you clear by now? G, any questions?